Hey everybody, Luke Gordon, physical therapist here, and in today's video I want to share with you the 4 most common causes of shoulder pain. Now shoulder pain is one of those things that we see a lot of with our physical therapy clients here at the clinic, second only really to like back pain and sciatica. And some of the more surgical things. But shoulder pain is so common, and I think it's so common for folks because usually there's no specific cause for it. It just comes on, and it can last for months and years on end. It can be intermittent. It can be all sorts of fun things, and it's really hard to tell what's causing it. So in this video, I just want to talk to you about the 4 most common causes, and then of course I've got all sorts of other videos that talk to you about how to treat shoulder pain, how to strengthen the rotator cuff, all of those things. So let's just dive into the 4 causes. The first one, which I made a video about too that discusses it more in detail, is rotator cuff tendinitis. So tendinitis just means that one of the tendons in your rotator cuff is inflamed. It usually means like a local or a short-term inflammation, although you can have inflammation going off and on for months at a time. So if you look at your rotator cuff, it's those 4 small muscles that are stabilizing your shoulder joint. Your shoulder joint is that ball and socket joint. So as you got all this motion in your arm, you can move it all sorts of different directions, all sorts of planes of motion, including rotation. Your rotator cuff muscles are always engaging to help stabilize that ball and socket. That way it's in good alignment. So tendinitis just means that one of those rotator cuff muscles, typically your top one, which is your supraspinatus, has gotten inflamed. So now it's inflamed, it hurts, and usually you're having pain kind of down the outside of your shoulder here. That's the most common cause of shoulder pain, and it's, top 4 there for sure. I've got that video. If you want to know more about that, I'll pop the video up here, and you can dive into that one if you want to. But let's just move on to the second most common cause then, is a rotator cuff tendinosis. Or, the rotator cuff tendinosis. So tendinitis is more of an acute local inflammation. Tendinosis means that you've had that inflammation probably off and on for several months, if not years, and now the inflammation is actually causing some structural damage with the tissue. So it's different in terms of what it looks like with your history, and then it's also different in terms of how you're going to treat it. So as your therapist should be able to help you kind of differentiate, is it a tendinitis, local, short-term? Is it a tendinosis where now you've got some soft tissue damage? The easiest way to differentiate the two is basically with an MRI. So if you have an MRI, your tendinosis will show up on the MRI because you can actually see some damage to the tendon, whereas a tendinitis, it won't. The tendon is still in good shape. It's in good condition. There's no scar tissue. There's no fatty tissue. It just is irritated. So that's your second most common one, is tendinosis. The third one then, if we want to just keep moving along, is impingement. Again, I've got a whole video dedicated to impingement, but I just wanted to kind of lump this all together today for you so you can kind of just see how these 4 top causes kind of look alike, but then differentiate them a little bit. But impingement really is if you do certain motions with your arm, like going straight out to the side like in a chicken wing, or you cross your arm over your body and kind of like lift the elbow up, that's going to cause pain. Reaching behind your back like to tuck in your t-shirt or your button-up shirt, or reaching into the back seat of your car. Those are all causing like a twisting and lifting motion in that ball and socket joint. And then you get what we call impingement. And essentially, when you get impingement, you're pinching that top rotator cuff muscle, that supraspinatus. So the pain is very similar. You're just going to differentiate by saying, okay, well, are there these certain motions that are impingement motions that cause your pain? That's how you know if you have an impingement. And again, I have a whole video on that you can look up as well. The 4th common cause then, or most common cause of shoulder pain, is going to be an actual tear in your rotator cuff itself. Now this could be a small tear, a partial tear, or it could go all the way down the spectrum to a full tear. And diagnosing those is a little bit different depending on the severity of the tear. With a full tear, you're going to see things like complete loss of external rotation strength. You're going to have, for an obvious tear, people aren't going to be able to lift their arm without doing this really funky compensatory movement pattern up here. So if you can't lift your arm, even if there's not a whole lot of pain, you could have a full tear in your rotator cuff. Again, usually your supraspinatus muscle, but it could be infraspinatus, could be teres. So that's the 4th most common cause, is an actual tear. Again, if you have an MRI, you're typically going to be able to visualize those tears, versus an X-ray won't really show you any of that stuff. So those are the 4 most common causes. And again, when you're looking to eliminate your shoulder pain and get rid of it once for good, and use your arm for reaching and throwing and lifting and just basic household activities, you want to just know what's the cause of my pain first, and then what can I do to eliminate the pain and get back to all those activities second. So that's the video for today. I'll post some other videos here to help you treat some things. I've also got a really good video on tendinitis versus tendinosis if you want to learn more about that I'll post here. So that's my video for today. I hope it helps you with your shoulder pain. Please like and subscribe before you go, and feel free to leave me some kind of a positive comment below the video. That's it. Thanks for watching.